Hello, I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we are here in Oakland, California with Dr. Okine. Dr. Okine is a board-certified veterinary internist and is the founder of a mobile veterinary practice that provides ultrasound services for animal hospitals in the Bay Area. Today, Dr. Okine and I will be discussing urinary tract infections and bladder stones in our dogs. So, Dr. Okine, thank you so much for being here. Can you tell us what are some of the symptoms of a urinary tract infection?
So a lot of the symptoms are the same symptoms that we would expect in people. So difficulty urinating, pain with urination. So if they're a cat, in and out of the litter box. If they're a dog, asking to go out frequently, straining, not really producing a whole lot of urine, and uncomfortable. Sometimes they'll cry during it. Also, if you see any blood in the urine, that can be a sign of a urinary tract infection. So those would be probably the most common symptoms to look for.
So what are the common causes of a UTI? What allows our dogs to get a UTI?
So sometimes it's their anatomy, their conformation. Overweight dogs or dogs that have folds kind of covering their urogenital tract can trap in moisture, trap in bacteria that can migrate up from the outside and go inside into the urinary bladder and urethra. So they can get a urinary tract infection from that. I think their grooming habits, kind of cleaning themselves back there, they can self-contaminate as well.
So what are the treatments for a UTI in a dog?
So diagnosis is key. We all love to be able to say, this looks like a urinary tract infection, but until you have that diagnosis, you don't know for sure. Dogs and cats can have stones, they can have crystals in their urine that can mimic the symptoms of a urinary tract infection, but there may not be any bacteria there. So you really want to get a sterile urine sample, test it, culture it, see what's there, and treat based on that information. But usually we're talking antibiotic therapy based on a culture, so we know what the bug is and what antibiotics it's going to be susceptible to.
So tell me, what would happen if a UTI goes untreated in a dog?
So sometimes these guys will have urinary tract infections that they're not symptomatic for, and it may not cause a problem. But that's a healthy dog with no other predisposing factors, no other causes of immunosuppression, where it can sit there and not necessarily cause an issue. Most of the time it's going to cause them discomfort, pain. It can also change the composition of the urine and cause them to develop crystals or stones. So we can see in some cases if a UTI goes untreated that they can develop other issues from that. Or potentially the bacteria can migrate up into the kidneys or migrate into the bloodstream and cause other issues.
So Dr. Okine, can you tell me what exactly are bladder stones in dogs?
So they're actually mineral deposits. So basically there's some sort of nidus or center, and oftentimes it is bacterial infection, or it's minerals that are being excreted from the kidneys that as they're mixing in the bladder, almost like the snowball effect, where a little crystal, can turn into several crystals that can turn into an actual stone. But most of those stones are actually going to be some sort of mineral, and the center could be, a bacteria, something that started the whole cascade to begin with.
Oh, wow. And is there a way to prevent bladder stones in dogs?
So there can be. If it's urinary tract infection based, it's kind of hard to prevent that other than to get those symptoms checked out if they're there. But again, there's some dogs that don't have any symptoms of a urinary tract infection, and sometimes you don't discover it until they're going in for the bladder stones. Typically with other sorts of bladder stones, they can develop if there's a lot of minerals coming through the kidneys. So if we know, for instance, that it's a type of mineral where we can use diet to decrease the amount of minerals being excreted through the kidneys, that can help decrease or even prevent the bladder stones from coming back.
Now, at that point where you do have the bladder stones and you're talking about, is it surgical removal? Is it diet restrictions or changes in diet? What's the treatment look like from then on?
So it depends on what the stone is. The only stone or crystals that can actually be dissolved are struvite crystals or stones, and usually that's going to be from a urinary tract infection. So if there's a urinary tract infection there, in some cases we can assume that might be what the stone is. And so then the option would be potentially for diet dissolution to dissolve those crystals or stones. In some cases, the stone has different layers with different compositions, so you may not be able to dissolve the whole thing. Or it might not be the right thing for you. If your dog is a male dog, if the stone gets to be a certain size, they can cause an obstruction.
Oh,
so
wow.
There's kind of pros and cons to trying to dissolve them. If the patient is really symptomatic, then sometimes what we'll do is take them to surgery and actually remove the stone. That way, we just get in there, clean everything out. There's really no downtime waiting for something to happen. We're just removing them. Or there's also lithotripsy, which actually breaks the stones apart in the bladder, breaks them up into tiny pieces that can then be excreted as the pet voids.
We'll be back with more Care Experts after this brief message from CareCredit.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion with Dr. Okine. Now, do dogs get bladder stones at a certain age? Is it typically older dogs, or does that matter?
So it can be any age. So there are some pets that have genetic abnormalities that they're born with, like liver shunts, where they can actually produce a lot more of these structures that can cause stones. So they can be born with issues that cause them to develop stones from a very young age. Anyone can get a urinary tract infection. So again, any age that would be possible. And then there are some, again, other genetic diseases that tend to happen kind of middle age. So I'd say anyone can get a bladder stone. It really just depends on the right circumstances.
And what about breeds? Are there certain breeds that tend to get bladder stones more?
There are. So it tends to, again, go with those genetic abnormalities. So we tend to think of more of the liver shunts being kind of those small breed dogs, kind of toy breed dogs. But there are some large breeds that can get liver shunts as well.
So if my dog has urinary crystals, is that a sign of bladder stones coming, kidney stones? Can it be cancer? What would that dictate to you as a vet to look out for?
So it could be any of those things, unfortunately. You had mentioned cancer, so I'll address that one first. If they do have a bladder tumor, for instance, and it prevents them from being able to get rid of all the urine, they can get a urinary tract infection that can cause crystals. So it really can be a sign of any issue with the bladder. If they have crystals and it's left untreated, again, those crystals can coalesce, cause stones down the road. So it doesn't necessarily mean that they have stones then, but it could indicate that there's the right environment for stones to form. So it is something that should be addressed sooner rather than later.
So if my dog does have bladder stones or is prone to bladder stones, does that mean they're more likely to potentially get a bladder cancer down the line?
We don't know. So any sort of irritation or inflammation, I would argue, could cause enough damage or enough DNA change that cancer could happen. So I would say it's not a cause, but it could be a precipitating factor. It could be one more checkbox or one more, link in the chain that could lead to that down the road. But it's not necessarily a causal relationship where if you have this, you're definitely going to get bladder cancer.
So don't panic is what you're saying.
Correct.
Just don't think of the worst and talk to your vet and figure out what your options are for treatment.
Correct.
And all that. Okay.
Exactly.
Okay, thank you so much, Dr. Okine. This is also a tricky subject and so scary when our pets start behaving differently on our walks or not urinating properly. So I really appreciate you breaking down all of the issues of bladder stones and urinary tract infections. Thank you.
You're so welcome. Thank you.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. And Pets Best offers comprehensive pet insurance plans that can cover up to 90% of your pet's unexpected eligible veterinary expenses. Together, Pets Best and the CareCredit credit card allow you to have a lifetime of care for your four-legged family member. Visit carecredit.com for more information.